Well, good evening from Monrovia and welcome to Focus on Liberia Online Television Network. We in an exclusive interview with Mr. Joseph Sackor. He's the Executive Director of the Liberia Medical Mission. The mission is currently in Liberia. We'll be finding out why are they here and other issues as well as we move along this exclusive interview. And so wherever you are joining us, whatever you're doing, it's my pleasure to say welcome to Focus on Liberia Online Television Network. Having said that, let me quickly welcome Mr. Sackor to Liberia first of all, and Focus on Liberia, even though you're not a stranger. How are you today?
I'm doing wonderful. It's always, a good thing to be in Liberia. I love my country, my birth. I'm always in Liberia, so, thanks for having me.
And let's know from you quickly, for how long have you been here and how does it feel being back home?
Well, I have been here roughly 2 weeks now because I came as an advance team to prepare the ground for the arrival of the mission. But the entire mission arrived last Friday, and some are still coming. Two doctors will be arriving tomorrow from the UK and other places. So.
Okay, great. So basically tell us, why are you in Liberia and what should we expect?
Well, we are in Liberia, as we have done in previous years, on a medical mission. As many folks know that Liberia Medical Mission is a non-profit organization, non-political, based in the United States, and is also registered as a local non-profit organization in Liberia. We have been coming to Liberia for the past nearly a decade, providing free eye care, mental health, and general medical services to the people of Liberia at no cost. We are not an organization that is self-funded, but that I mean, we don't have any reliable source of funding. Okay, we fund ourselves through individual contributions and contributions from community members, Liberians as well as non-Liberians. Those who have followed us, those who have seen our good work, and those that believe in us, are the ones that have kept this program going. So this is who we are. So for this year, we brought nearly about 29 medical, mental health, and eye team.
Okay.
And a container of medical supplies and medication. So the team is divided into three. The eye team is expected to give gifts of sight to 200 Liberians, meaning that we will be conducting over 200 cataract surgeries in the country before the end of the mission, before the 12th of March.
Okay.
If everything goes well, we brought professionals from 5 different countries: the United States, the United Kingdom, Australia, Nigeria, and Ghana.
Okay.
So a total package of a $4.2 million assistance package to Liberia. That includes the medication. This amount does not take into consideration the professional services that we'll be rendering, like the eye clinic, like the outpatient clinic, like right here in Parkline, where our team will be working today, and in Bannersville, where they have worked for so many days.
Is it a mobile team or you are stationed at specific health centers?
Well, we are a mobile team, but the eye team is stationed at we're screening at Redemption Hospital After screening, we referred those that were qualified for surgical procedure to 40 military barrack,
Okay.
where our eye surgeons have been, doing the procedures.
I heard you mentioned Redemption Hospital and 14 Military Hospital. Besides those two hospitals, where else have the team visited, or where are you concentrated?
So right now, like for the eye team is concentrated on Redemption Hospital and screening at Redemption Hospital, the actual procedure at 14 Military. As of next week, the other ophthalmologists coming from the United Kingdom, from London specifically, will be traveling to Kanta Methodist Hospital. I'm going to send that team to Nimba County to give an opportunity to those in the rural areas to benefit as well. Because for the past missions, we have not taken any mission outside of either the western area. So, for the rural condition now, I decided to move, part of the team to Nimba County. So the remaining, they will have 100 cases there, 100 cases in Monrovia.
Great. Let me ask you this question, Mr. Sackor. Is the Ministry of Health in the know of being in country at the moment?
Yeah. We have been in partnership with the Ministry of Health,
Okay.
and they have been supportive.
All right.
Matter of fact, they help us process the duty-free.
Okay.
Majority, nearly 90% of our medication was airlifted from Los Angeles Airport to Robert International Airport.
Okay.
So, through the help of Ministry of Health, they wrote on our behalf to the Liberia Revenue Authority to grant us duty-free. Not only that, they did underwrite the cost of issuing, temporary licenses to our visiting doctors. So yeah, they've been very supportive in that line.
Great. So, from your own assessment, since you returned to the country, what have you noticed in terms of our health sector? What is your observation?
Well, the first thing I want to say is that my hat's off to the healthcare workers in Liberia.
Okay.
They're doing an amazing work on the resource constraint, situation. They do not have all the necessary tools that are available to us in the United States, but yet still, they're doing the best they can. The things that have changed, some things that still remain the same. But I think together the goal of the Liberia Medical Mission is to work with the government to see improvement in certain areas. We know government hands are tight, so they have a lot of things on their plate. This is where we intervene,
Okay.
as Liberians, because this is the country that we have. Okay, if we want to see the changes that we want to see, it is we, the Liberians, that have to introduce those changes and make sure that we are committed to, to bring those changes. And this is why the Liberia Medical Mission, come in the country and ask the government, how can we help you? How can we help you improve, the healthcare system?
Mm-hmm.
So that's basically our mission.
So that means, from your own assessment, you think there's a need to improve the health sector of our country?
Well, yeah, absolutely, sometimes I tell people, Liberia used to be a country where folks from the neighboring countries will seek medical attention. Right here in Liberia, people will come from Sierra Leone, Guinea, Ivory Coast, okay? When they have a complication, they will travel to Liberia. I remember those days, Lamco, Phoebe, and all of these places. All of these places were actually places that people used to go to seek medical attention, all right, prior to the war. Okay, but now, after the war, a lot of infrastructures were destroyed, and most of the doctors did not return. So we lost a lot of things. So so it's like gradually we are beginning to put the pieces together.
Great.
And who are better to put those pieces together than the Liberians themselves? So, and this is why the Liberian Medical Mission is in the country to provide these needed services.
Let's talk about the cases you and your team have been treating. How severe are some of those cases you've encountered?
That's a very good one. So let's start with the eye. I'm going to share a video with you. A lot of emotional, cases that we have come across. An elderly person who has been blind for almost 20 years, just due to cataract. They brought him from the village, and luckily he was picked up for surgery. Right? So during his testimony yesterday, he told us that I have a farm, and I am a farmer. I have been doing this thing for living for so many years. I send my kids to school from farming. Okay, but for all of these years, I've been blind. I've been dependent on the society. I've been dependent on my grandchildren. I've been dependent on my children for everything in my life. Okay, from taking a shower to eating to taking me around. It was very difficult for me to even go to church. Right, but thanks to your intervention, now I can see. I don't have to depend on anyone again. Now I can go back to a work that I can do better.
You mean after 20 years of blindness?
Yes, after 20 years of blindness. I'm going to share the video with you.
Okay.
So these are some of the emotional, things that we come across, and these are some of the things that have kept us, that have kept inspiring us as individuals. Because as an organization, people usually ask, well, you are not funded. Why are you still in this, keep going to Liberia and you are not getting that support? It's because of some of these cases that we encounter. So after this surgery, the old man came, he said, look, I do not have money, but what you have done for me, all what I need to do for you, I want all of you to come together, let me offer my prayers to you. Those are the prayers that we depend on. Those are the prayers that this particular organization depends on and needs. So, I mean, there are so many of them that we actually, have encountered, and we continue to treat. So, those are some of the things.
Okay. Great. Well, folks, if you just join us, you're watching the US-based Focus on Liberia online television network, and we are in an exclusive interview with Mr. Joseph Sackor. He's the executive director of the Liberia Medical Mission, and the team is here in Liberia rendering some health services to underprivileged Liberians, if I'll call it that way. Mr. Sackor, let's talk about the issue of mental health. You and I know that is one of the major problems we have within the health sector of our country. Let's know from you, how do you get your mental health patient? How have you been getting them? Do you go and take them from the streets, or what? What do you do?
So first of all, as I was showing the conference room, so this year the approach that we have employed is that of education. Because in Liberia, sometimes mental health is overlooked. Okay, so in some areas, it's like a taboo. You can talk about it. So the first thing is to create an awareness.
Okay.
All right. Seeing people, picking up things in the garbage cans and all this stuff. All right. Yes, we do see those physical signs. But what the team is doing this year is to put a team together. A lot of our volunteers, participants from different civic organizations, those individuals that interact with our disadvantaged youth on a daily basis. all right, law enforcement officers, nurses, doctors, managers, bringing them together and discuss mental health issues. What do they think, are the main causes, and how can we address those root causes of mental health in our society?
Okay.
All right, how do we, proliferate that awareness within our society so that people are aware, and how do we make ourselves better? So in that line, excuse me, wait a interview, just lower voice. So, sorry audience. So that's the kind of training. So we will be bringing about 80 people from different civic organizations that have been trained. We started on Monday. Okay, so these young people will be trained to go in the communities. Also talk to our disadvantaged youth. Okay, what they need to at least empower themselves. Okay, what are some of their challenges? How can the society be of help to them? How can they help themselves? So that's the kind of training that we have been conducting in partnership with an organization based in Baltimore, Maryland. They came, they have been doing an amazing work. Currently, they're training in Montana and Malaysia and all this stuff. So they agreed to come with us on a humanitarian basis. Normally, they would charge $4,000 per participant, but they decided to come with our Liberia Medical Mission to provide this service.
So how many mental health cases have you treated since you arrived in the country?
So we are not actually treating the actual cases, but basically this year we are doing the training.
Training.
Mental health training. Okay. Because we want to make sure that we have our young people who are aware, who can sensitize the community, all right? Who will be out there informing people that, hey, mental health, there is a crisis, and how do we work together to minimize this crisis as a country? So that's the kind of training we've been having. So people came from LBS, people came from gender ministry, people came from law enforcement agencies, different, you can name it. So that's what we have been doing in the area of mental health this year. But in the previous year, we partnered with Carter Center, and we have brought some drugs, medications for the mental health patients, and sometimes we have brought real psychiatrists to go and assess them and see how best they can treat them. But our mission usually lasts for 2 weeks.
Okay.
So we decided that it will be of a greater value to the society if we train people that will continue to work after. Yes, exactly.
Somebody wants to know, what are those things that lead to mental illness?
Well, as general information out there, so I am not a mental health expert.
Okay.
So we do have, leads. Okay. So Wally, and our lead person is Dr. William Simmons, who is a clinical psychologist. She is responsible for the mental health piece. And Dr. Sila from Atlanta, responsible for the general outpatient. And we have Dr. Major, who was also responsible for the I team. So each of those individuals are responsible, at least to discuss, to actually put plans together on how to move about, the operational aspect. I left with the team leads. So the administrative aspect and the overview, recruitment and a mobilization of the resources and different aspect, budgeting. That's what I come in as the executive director.
Great. And so you've been around Monrovia and its environs. Let's talk about the reception as per your presence in some of those areas. How does it feel in terms of the reception?
Oh boy. Sometimes we go to some places, like yesterday we were in a Bannersville Keba community. It was just awesome. People were dancing. I could see the old folks that, yes, it's about time that our own children who could speak our own dialects, you know, that we could confide in them, all right? Come to us at least to educate us, to treat us. It's about that time. So they were very, very, very happy. Some of them will cook for us. Some of them will bring coconut, you know. Some of them will just come and just offer prayer.
Okay.
So, I mean, the reception has been amazing.
Okay.
Yep. So, but in fact, there are people, like one lady just put like 2 cases of water on a motorbike. Just came here, then I just asked for the Liberia Medical Mission. He said, we appreciate you, you know, I don't have money to cook, I don't have anything to do, so I am actually reaching out to you, you know, this is my little way of contributing to the mission, just to show my appreciation. So those things mean a lot to me.
Mr. Sackor, how long have the medical mission been in existence, rendering health services to underprivileged people? How long have you been in existence?
It's been over a decade.
A decade.
Yep.
And what actually motivated you and others to get involved with that?
The motivation for me in 2009 when I came to Liberia to see my late father, at the time he was sick. So I got here, then I saw him, you know, I realized, okay, Ben, you know, I'm not a medical doctor. So a friend of mine came, we were all in Liberia together. So she is a nurse practitioner, specialized in in the cardiac area. So I was asking around, so she came and saw, I said, no, you have to see a cardiologist. He said, from what I'm seeing, your dad may have some cardiac related sickness. So we started calling around and we identified one Egyptian by the name of, I don't know, Hussein. I think that his name was Hussein. So I wanted to transport my father to the clinic. So I asked my nephews to call for an ambulance if they have any number for ambulance. Because we don't have an ambulance system here. So the only thing that we can do is to put your dad in the SUV that you had, that I had at the time, or we just rent a cab. So I said, well, that didn't make a lot of sense to me, but apparently that was what was available at the time. Okay, so we managed to put my father in the car, all right, and we went to Vietown, where the cardiologist had his clinic. Upon arrival, we had an opportunity to see the cardiologist, but one thing that really struck me was that when he told us that he could not take a new patient at a time until after 3 or 5 months. So I'm like, okay, what will become of my late father at the time after 3 or 5 months? So my friend that I'm talking about, I came from Chicago, just did a quick prescription. He said, your best bet is to get your dad in the US. So I came, my father didn't like going to the US. We tried to at least get him there, but no, he just loved his Liberia. I came and I discussed his option, and so he told me, he said, okay, I know you'll soon be going, but my advice to you, this is your country. There are thousands and thousands of people like me that having these various sicknesses who do not have relatives in America or anywhere except in, Liberia. They do not have the opportunity. So when you return, okay, there's a possibility that you may not meet me again. I don't know, but think of Liberia. All right. So think of Liberia. Do not forget about Liberia. There are others that would need your services. those messages have been resonating with me, even though, so 6 months after I left, my father couldn't make it, so he passed away. So that has been my inspiration, okay? Because even though I love my country, but those words from my late father, every time I even want to, like, sometimes it is really, really challenging to bring the mission, very frustrating, but when I think of all those words from my late father, and I would just say, no, I will not let you down, okay? Those were my inspirations. And since then, no matter how difficult the situation is, we have tried among ourselves. My colleague, Roberta, my wife, my family, you know, Dr. Siemens, Dr. Sila, the core people, Ben Weaver, all of these people have always been coming together along with our non-Liberian colleagues to make sure that whatever it takes, we'll get to be doing this thing. Okay, so this is, and this here is where we are. We have saved thousands and thousands of lives around the country. We bring medication. We replenish pharmacies around the country. We bring equipment. We bring biomedical engineer to come and repair broken equipment. Okay, some of the hospitals have a lot of broken equipment. We have gotten some requests. We'll be going to some of those clinics tomorrow to go and have them repair them because they can't afford to repair them. Okay, so we come and do that. So that's a saving for the country.
Okay, besides our care and mental health, besides those two services your team is currently rendering,
And
what
outpatient.
else? Say that?
The general outpatient.
All right. Besides those three, what else does the team tend to render?
So besides that, the biomedical engineering services, that is helping clinics, hospitals to repair the broken equipment, the malfunctioned equipment. That is.
All right. We are challenged, this country, we are challenged in some sectors, or if not almost all of the sectors. You came with a huge delegation to Liberia. You brought lots of equipment. The issue of electricity is a major problem here. I'm sure you are aware of that since you came. How are you managing with all of those equipment you brought to the country?
The reason why I was just shaking my head was that one of the biggest challenges that we actually encountered during this particular mission was the issue of electricity. At times when the current went off, we have our iPhones. Everybody, we asked 2 or 3 of the volunteer nurses or doctors, they put the iPhone lights together, then now keep moving. Okay? So, and 2 of our doctors brought the equipment, okay, from Nebraska and Ohio, their own microscope. When they got here, they went online and did a research. Google told them Liberia uses 110. So yeah, so that's compatible with the voltage system in the United States. That's fine. So they brought the equipment. At 14 military, we're using 220. So we use the transformer, the converter. We set that to 110.
So that means you have to convert from
Right.
220 to 110.
Exactly. So after they had operated on the second case, someone, the technician over there, you know, the doctors have gone, you know, escorted the patient before they could come because they are used to, you know, the 220. So this person was not in, came from the other side and saw that it was on 110. They thought that it was set to the wrong voltage. They switched back to 220. When the doctors were ready to put on the microscope, they turned on the equipment, it blew up the fuses. Okay? So, those are some of the major challenges we've been having this week. So instead of 2 persons working on 2 cases simultaneously, So they have to, the biomedical engineer have to only manage, kind of modify and get a fuse from somewhere. So they operate only one machine. So which actually poses a lot of challenges. Because the goal was that, one person do 20 cases a day, so 40, or an average 10 to 15 a day. But now, with one microscope, and there's no microscope for the military, so we were relying on the microscope that they brought. It got, blown off.
How is that affecting your operations?
Enormously. Not only that I feel bad for them because they took their own microscope and paid money because they're heavy, they're over 50 pounds, they pay money for it, and I accidentally, it got blown off. So, they felt bad that the reason for which they brought them for was not full, it was not fully utilized.
Okay.
So, yeah.
Are there plans to decentralize your activities, even though you talked about decentralization, but you did not go in depth? Let's know from you for the sake of our viewers. Are there any plans to decentralize?
So, I don't know, when you talk about decentralization, you mean decentralization
To leave Monrovia and go to other parts of the country,
absolutely,
rural parts,
absolutely,
where you have so many cases, I'm sure.
Yes. As I mentioned to you earlier, I will be sending a team of ophthalmologists to Nimba County.
Okay.
The ophthalmologist that's arriving tomorrow morning from London will be sent. He will do some operation in Monrovia for 2 days. Then Sunday, he will travel to Nimba County. That will already, because there have been announcement that we are coming. So I just got from the national coordinator, the eye coordinator, that they have booked off more than 100 cases already. There are folks that are traveling from the villages, are coming to Ganta, at least to benefit from this, eye service. Okay. We also have an outpatient mobile team traveling to, Bansa, Clepier, Ganta, and Sanikole, to those, 4 areas. So I'm going to leave another team here. The team that's going to remain here will go to Bapolu, Bomi, Magibi, and Cape Mount. That will be like a day here and a day there. At least for people to at least, get some benefit from the Liberia Medical Mission. In the long run, or in the short run, if all goes well and roads are accessible, my goal has always been to go deep down in the rural area. But with our days numbered upon arrival, we're only here for 2 weeks. The moment we arrive, our clock starts ticking.
Okay.
We can't spend 3 days on the road. Those 3 days will have saved more lives to where there's accessibility to the patient. So this is what has really hampered or really deterred us from going to the rural areas.
Mr. Executive Director, what is your target in terms of the number of persons you want to deliver healthcare to before your team can wrap up?
Again, our projected number of beneficiaries this year, we set a projection between 3,000 to 5,000 people, if all goes well. But sometimes we run into challenges, like vehicles, like today I wanted to send people to different locations, but I didn't have vehicles. I had to call some friends to let me use the vehicle, So I am very grateful to our UN partners, the VHO. Was very generous enough to rent a 16-seated van that we have been using.
Okay.
My nephews and friends, I took their cars from them. said, well, hey, you know, we all have to contribute. There are individuals that I have called, you know, say, hey, I need you to at least fuel, you know, give some fuel for our team workers to go. All right. So now I need to figure out now. I just called before you could come. I was just on the line with a friend of mine who's leaving from Kakata to bring his car tomorrow. So, you know, those challenges are there. Okay. But with everything, if everything goes well, we get the vehicles, we get the fuel and everything. Yeah, that projection, we will meet our goal. But again, there are some constraints. We're constrained.
So that means regardless of the challenges, you're optimistic.
I'm still optimistic. You know, I'm someone who's I'm an optimist. So even if we miss our target, yes, but at least we have tried. You know, we have tried.
As we wind down, Mr. Sackor, what could be some recommendations for the health sector of our country, as per your own observation since you arrived?
Well, like I said, the healthcare workers in Liberia, man, my hats off to them.
Okay.
My hats off to them. They're doing a great job. Whether we like it or not, yeah. You know, with the limited resources available to them, they're doing their best. Okay. So my call to, you know, our fellow Liberians and whether in the diaspora, let's come together. Let's, you know, incentivize people that want to do good work in Liberia. Okay, it's not all about politics. Sometimes people see us doing these humanitarian work. Although, yeah, the folks that are coming from America, after one or two things, then they want to be representing and all this stuff.
I was just about to ask you that, Mr. Sackor. Has there been any interference politically with your work? Maybe because you know we are approaching elections, perhaps someone could see you and want to chip in, maybe by means of political will also. Have you encountered such?
No. Because during my press conference here, I made it very clear. I made it clear that no, you know, our organization is non-political, period.
Okay.
All right? So we are here on a humanitarian mission, all right? We are not here to campaign for anyone. We are not here to support any political party. We are only here to provide these needed services to Liberians, period. And last time, it's funny. So sometimes people will come. You know, a couple of years ago, I had some group of you know, amazing women came to my hotel. Oh yeah, you've been doing this something. We want a petition. Petition for what? I said, forget it. Not me. It's not. I don't dream about it. You know, I don't think about it. My mission here purely is humanitarian. And now, you know. So again, as I was saying, so we need to come together. Liberia Medical Mission, we don't need to reinvent the wheels. We call all the nurses in the States, Canada. So let's put our efforts together. And for the folks in Liberia, when you receive a mission, so at least welcome them with open arms. That's what you've been doing. Encourage them. Because for all of us here, no one in this organization or no one on this team, whether a volunteer from Australia, who spent about 40 hours, my weekly, you know, hours, work hours, spend that just to be in this country. So when people volunteer their time and their services, their money, their high-end money, so we should try to appreciate them. That will encourage them to come back. All right? Like someone getting on a motorbike, 2 cases of water. Say, look, I appreciate you guys. Thank you so much for what you're doing for the country. Okay. And to our many donors. Focus on Liberia. You know, they've all been supportive. Okay? and our local donors here, Sons, and Ala Lagoon, Colonial Hotel, and individuals, McCarthy, we have Hero International, the Global Couture, you name them, okay? Elizabeth Armstrong and Associate, So there are so many organizations all around the world that have been chipping in. $20 here, $5 here, all of these things. So let's come together then and to support one another so that we can all help, Liberia. So this is what I want to put out there, and please continue to support us because we need your support. Even if we're here, we have bills to pay. Okay, come on, call on Liberia, chip in, and for also provide these services. If you're here in Liberia, hey, you can cook for the team. You can invite the team for a dinner. Some of our volunteers are returning tomorrow back to the state, and some are coming tomorrow. So stick out on their support.
I'm sitting here just wondering how you managed to convince all of those you have as the team members on board now, so to speak. How did that happen?
Well, that is part of the leadership skill, So as a leader, you need to be persuasive.
Imagine somebody traveling 30 hours.
30 hours.
Coming from distance to
Yeah.
Liberia.
Yeah. And many of these people have never been to Africa, let alone Liberia. Never been to Africa. Their first time seeing Africa now will be Liberia. Okay? So, what do I do? Because two things I've been doing. Not only do I provide we provide medical services, but Liberia Medical Mission also, is like a PR for our country too. Come and see for our country. As a result of some of these missions, guess what? There is a discussion now between the Liberia Medical Mission and the University of Pennsylvania Department of Urology to kind of develop and improve the urological services at JFK. We have started that.
Okay.
So where they are willing at least to do some funding, you get some of our doctors coming over, to the States for observership, for also training. Okay? So we do all of these things because we want to see the changes that we want to see in Liberia. And how do we do that? It's through commitment. And now, those that know me, I don't take a microphone and I just announce, oh yeah, this is what we, Liberia Medical Mission, is doing. So a lot of people don't know, what we are doing. So when they go online, Google all that, and say, wow, I didn't know that you're doing all of these amazing stuff. So, this is our country. So we gotta do what we gotta do. These are our uncles, these are our nephews, these are, our people.
Okay, your closing comments as we wrap up.
My closing comment, first of all, I want to say a big thank you to you and your colleagues from Liberia, to all the media groups that have contacted us, that have I come to look at the job that we do, that have followed us, not only from the hotel, but that have gone with us on the field to interview some of the beneficiaries, to look at the those emotional feelings after they have received those services. Okay, how grateful they are. Okay, so I'm thankful to all of our donors, the Samaritan Purse, those that are giving us these huge millions of dollars worth of medications, from a Samaritan Purse, from Direct Relief, Brothers and Brothers Americares, to our international community donors, the Liberians abroad, and to Liberians in Liberia who have chipped in here and there. We want you to continue to support us financially. Okay, you have seen on our Facebook page what we have been doing. Okay, all the cases, those that we have mentioned, and there are more cases that are going to be seen. It's very difficult. We got bills to pay here in Liberia. Okay, and we got to feed our team. So all of those things are done by us, nobody else, no contribution from anywhere. And I want to also thank the Lebanese community here who have been supportive, and we want to say thank you to the Ministry of Health and to the Liberia Immigration Services and all the government agencies, and to the President and the First Lady, the rest of the government agencies for working with us and for allowing us to be in the country. So I really appreciate everybody's time. To your audience, thank you for being with us, and continue to follow us. Okay, until we end our operation in Liberia, continue to follow us, and you'll see some of the amazing work that we are doing. Okay, so thank you so much for having me.
Thank you very kindly. Mr. Joseph Sackor is the Executive Director of the Liberia Medical Mission. You've heard him talk about all of the happenings since the team arrived in the country. Well, folks, thanks for watching. Join us again. Maybe we should have joined the team in the field to talk to some of the people who will be directly affected as per the medical assistance. So thank you very kindly for being with us. Have yourselves a great day.